Hello and welcome. This is the Baker Senior Show. And today we're going to be talking with Steve Baker about Medicare, not only here in the United States, but how does the world handle their seniors? And today, Steve was telling me that we we only see what we are doing here in the United States for our seniors, but we want to take a wider view and kind of understand all the different ways that we could be taken care of after we reach the age of, what is it, Steve, 65?
65.
All right.
Exactly.
So give us an overview of the healthcare here in America, and then we could talk about the world.
Okay, great. Great. Just as a review, I think I did this once before way back, and I talked about how Medicare itself came about. Medicare is a brand that the United States owns in terms of senior health care. So Medicare is something that, and actually there's a federal agency uh, that's in charge of Medicare and Medicaid. So, and they make pretty much the rules. But way back after the end of World War II, uh, Harry Truman, in April of 1945, became president. He was sworn in right after the death of Franklin Roosevelt. So he served that term out, and in 1948, he ran for re-election and won his seat. I mean, he won the presidency outright through an election. So all the while he figured that we needed some help for the seniors, and had it in the back of his mind. And so he came up with an idea of presenting it to Congress, and Congress rejected it outright. And this is in the early stages of his first administration. And so he just kind of parked it and so forth. And then in 1948, he won for re-election, and he tried it again. Still, he couldn't get it through Congress, because right now it was different in those days. The Democrats were the real conservatives, and the Republicans were the more liberals. Now, in these days, in 2020, it's reversed. So the Democrats are the more liberal, and the Republicans are the more conservative. But at any rate, he still couldn't get it through. So he just parked it, and then in 1952, when his time was up, President Eisenhower was elected, and he served 2 terms. He served 52 to 56, and then 56 to 60. And all that time is just still back there. Nothing was being done. So as we know, there was a very tragic thing that happened in this country. President Kennedy was assassinated. Lyndon Johnson then was sworn in as president. Now, Lyndon Johnson came from Congress. I mean, he was a Senate Majority Leader for years and years, and had a lot of things. Sometimes cynically, people say he knows where the bodies are buried. he
Ooh.
knows he knows a lot of things. He has a lot of things on a lot of people. So then he could twist and turn and pull and connive and say, "You remember that? Oh yeah. Well, okay, I won't ever bring that up," kind of thing. So he was more or less in charge. So he said, "Okay, we're going to have some sort of Medicare for seniors." And so because of that, because he had power transferred into the White House, he got it through. So there was a Medicare program in 1964, 1965, in that range. And Harry Truman, way back, now Harry Truman is 81 by this time. So Harry Truman received the very first Medicare card that was ever issued in the United States. And Beth Truman, Bess Truman rather, Bess Truman received the second one. So then that was the start of Medicare. They created an agency, and it happens a lot in all kinds of governmental things. Small agencies become larger, and they become larger and larger and larger and larger. And that's true of the Medicare situation as well. And it's been improved. It's been added to. In 2006, we added the Part D plans, which is the prescription drugs, to Medicare. So now we're off and running, and it's a full blown animal now.
Full blown animal, huh?
Yeah, full blown animal. And a lot of people are saying, well, maybe we should do this or do that or whatever. And I know we have an election. This is 2020 as we speak, and we're having an election, and a lot of discussion is going on about Medicare. Medicare for all, Medicare for this, Medicare for that, and who knows what's going to happen in the November election coming up. So that's all up in the air. So there's still going to, whatever happens, there's still going to be some changes coming up for Medicare. So this is where we are, and pretty much when you're 65, you've got a choice of two kinds of Medicare, and depending on what direction you'd like to go in, you can choose one or the other. So this is where we are now. In the meantime, around the world and other countries, things have been going on as well. They do have a medical program for not necessarily just for seniors, but for almost everybody. Canada in 1948, which is what Harry Truman wanted to do, initiated a medical program. And England did as well. And they call it a single payer. In other words, the government is pretty much all in charge. Private companies are not so much in the picture. Where we, with our Medicare program, is a mixture. It's a two-tiered program. It's the federal government with their Medicare situation, and then as an addendum to that, as a supplement or a gap, so to speak, the private companies come in and cover the gap, and that's where we are. So it's worked very well in this country. No one else around the world has the term Medicare. If you go to any other country, if you go to France as an example, or pick any country, Iceland, any country, they don't use the term Medicare, but they use just a single term, medical provider or Medicare insurance, medical insurance. So around the world, there's just all kinds of different kinds of in some countries, especially in countries like China and Russia, the government, of course, there's not hardly anything private. Government runs everything, so the government owns everything. And in a lot of the different countries, the doctors and nurses and hospitals actually work for the government. The government runs everything in terms of medical costs. So there's all kinds of different levels and so forth. But we have in this country, we still have our Medicare stuff for seniors when you turn 65, and it's worked very well for us. I'm not sure that we could ever go back and invent something that we have from the start, like we did in 1964. I'm not sure. I don't think we could ever do it. Start it up.
The only thing I would want to change is the name, because it's so close to Medicaid. A lot of people get confused about what's the difference, Medicare, Medicaid. It's not until you get to be older that you realize that Medicaid is for people who have a low income, and Medicare is for seniors.
Right.
So
yes, Medicare itself is a federal program for everyone. If you're a gillionaire, you can get on Medicare. That doesn't matter. If you're broke, you can possibly get on Medicare. so it doesn't matter. Medicaid is quite different. Medicaid is a welfare program where you actually go and apply. You have to have very low income, and the threshold is pretty low. In other words, if you make over, let's just pick a figure, if your income, if your resources coming into your household is over $2,000, you're not eligible for Medicaid. So it's a state-run program. And the federal government gives states what's called block grants. In other words, they send them a large sum of money. They send, okay, $2 billion for this state, $2.5 billion for this state, and so forth, according to population and so forth. So they will just turn the cash over to the state, and the state has to administer those funds and make sure that their guidelines will happen, and they want to make sure that those funds last through the year until it comes time for another divvy up from the federal government. They take a hands-off attitude about it. I'm sure there's some oversight and that sort of thing, but Medicaid is a welfare program. Medicare is something that's created, and if you're born in this country, you're a citizen or naturalized citizen or whatever, you became a citizen, then you actually can qualify for Medicare. Big difference between the two. So and it's working. It's working right along.
Steve, I hate to interrupt, but I just want to make sure I understand. Medicare is a government-run program, but they allow private companies to come in and help out where they feel like they didn't do well,
yes.
or that.
Yes. Well, there's basically the Center for Medicare and Medicaid is CMS, we call it, oversees everything. That is a government agency, and they oversee everything. They even regulate the private arm as well, and they tell them, you can do this, you can't do that, you have to do it with this way, you have to market the Medicare in a certain way, you have to say certain things.
And that's all run by the government. That's a government
yes.
oversee. Okay.
Yes, they make the rules.
Okay.
So the private company said, okay, we'll follow the rules, and so, but we're still an individual. For example, and you can have, there's numbers of them, but let's just say, using an example of one company, Mutual of Omaha is an example. Everyone has heard of Mutual of Omaha, right?
Yes,
they're a private
that's
company.
That's right.
Well, they do Medicare. They have a arm of their agency that does Medicare. So they attach their product onto Medicare as a supplement. They call it a supplement. Nowadays, it's called a Medigap policy. Medicare itself generally pays 80% of all the medical costs, like hospitals, doctor's visits, MRIs, CAT scans, all the stuff. Pays 80%. A lot of people could not even afford to pay the 20%, so they can attach a product on the bottom of it, and it'll pay the remaining 20%. So pretty much, if someone has the attachment onto their Medicare, they pretty much have 100% coverage. But they do. There is a very small deductible, depending on your income, that you've got to meet. But generally speaking, if you have a devastating injury or devastating illness or whatever, you're pretty, I think we talked about this last time, you have peace of mind. Then there's another cost called the Medicare Advantage, and it's quite different. And typically less income people move over to that direction. But that's in this country. You cross the borders, you go overseas, it's a totally different story. Absolutely, totally different.
Now, you're not talking about a United States citizen crossing the border. You're talking about someone who lives in a different country who...
Yes.
Okay.
Let's just say you move to another country. You move, I'll give you an example. I have a husband and wife who are Christian ministries, and they've moved to Argentina. So by doing, as missionaries, they're still United States citizens, but they're overseas in missionaries. But before they left, both of them were turning 65, and I initiated a Medicare program for them. That's only in this country. So when they do come back, they'll have their Medicaid, and Medicare all set up. They've got their cards and everything, but they absolutely cannot use those in Argentina. So they've got to adhere to whatever is over there for temporary people for Argentina. It might be totally different in Chile, and it might be completely different in Brazil. So each country then allows visitors, let's just say, non-citizens. Sometimes, the term is somebody has a dual citizenship or so forth. But let's just say Brazil. You're over there in Brazil for whatever you're working with. You're assigned over there by your company and so forth. So you've got to follow the rules of whatever country you're in. And so there's all kinds of different kinds of things going on out there.
Well, okay, so Steve, I'm sorry to, put a wrench in here, but what if you're working here in the United States and your company is worldwide and they send you over to another country? Are you still covered by Medicare or whatever insurance company that you have?
Yeah. Remember, there's two. There's a division. There's under 65 and there's 65. So let's just say someone is 47 or something, and they work for any major, let's say, oil company or overseas, worldwide company. Then they have a whole department that follows whatever the situation is, and they, I'm assuming that they negotiate healthcare costs for their employees whenever it's necessary or if it's necessary over there. So they're on top of it. They know they're just not going to expose their employees to their other countries' medical stuff. They have a certain guidelines and so forth that they have to follow. Have that all set up for their employees overseas.
Okay. I appreciate that.
Yeah.
I just want to make sure. I mean, I understand what you're saying. If you have a 501(c) nonprofit and you want to go over to another country to help out for some reason, is different than if you work for a major corporation and they have insurance for you or you have Medicare through them.
Mm-hmm.
I mean, everybody's going to be a little different.
Yes,
but
exactly.
What you're talking about today is the actual country and their policy on their seniors.
Mm-hmm.
Okay.
Right. So you have to make sure that that your health care is going to be at least overseen or taken care of in some form or fashion before you decide just to up and move over to.
And that's where you can come in and help them, guide them, and tell them. They can tell you their story, whatever it is, whether they're moving there for good or they're just to have a temporary assignment. Right, a temporary assignment. They're just visiting, right? Like my dream is to be in a camper van and travel around. Now, a lot of people want to go to another country and do that. So that would be totally different than if you were to actually move there and become a national, what do you call it? Citizen, a national citizen of their country. Okay.
Right. I'll give you an example. I have a client who she and her husband, I had them for quite some time, and they bought them a big camper. So they decide that they're going to Alaska. So they're going to go to Alaska.
All right.
And as you know, Alaska is our 50th state. I don't know if it's 49th or 50th, but anyway. Alaska is part of the United States, but they're gonna go up there, and so in order to get there, they have to drive through Canada. Canada is not part of the United States, so
Right.
they have their own healthcare system. They have their own situation. So they go up there and they're in this campground thing, and she's opening a can of something in her camper.
Now, this is a real story you're telling.
Yeah, this is a real story.
Okay. All right.
So
We're hanging
so
on to the end, waiting.
yeah. So she's opening this can, and somehow it slipped, and she reached for something and hit a knife or something, and it cut her thumb way deep. I mean, down to the bone. So here she is in Canada, and she just goes, "Oh, well, good. We've got Medicare." Yeah. I say, "Sure, you've got Medicare, but you don't have Canada. You got so I had to, because it's an emergency. They rushed her to the hospital, because she was bleeding like crazy. It wasn't serious, but it was deep, and she had this serious cut. So they had to sew it up and whatever, stop the bleeding and sew it up and bandaged it and whatever. So it came time for her to be dismissed, and they're asking for a sum of money. And she said, "Well, I have Medicare." And they're going, "Meta what?" I don't know what you're talking about. This is your bill. So, you need to pay the bill. Okay.
Oh, what happened? Oh my God, I'm on pins and needles now.
So then when they get back, she called me, frantically saying, is Medicare covering this? And I'm going, no, you were headed. It would be if you got to Alaska and crossed the state lines. That's the United States. The Medicare is fine up there, but in Canada, it's a totally different story. So, and I guess it never really occurred to them. I don't know, but we got it straightened out. By straightened out, I mean they paid the bill. So that's straightening it out.
So there was no help from anybody. It had to come out of their pocket.
Yeah, exactly.
Oh my God. That'll teach you to stay in the United States, huh?
Exactly. So they didn't call me or anything before they headed out, but it was.
Well, if they would have called you, is there something you could have done?
Well, I could have recommended a policy for that country that they could have purchased temporarily and stuff.
Oh, did you all hear that? You need to have Steve's phone number, okay? So just in case, okay, no matter what your question is, you need to call Steve, and if he can't answer you or help you, he can steer you in the right direction. So
I can find out. I can find the answer for them. I know where to go to get the answer.
He's not going to
leave you alone. I may not have
the
answer.
So I want you to call his phone number, and it's 832-754-3292. Now, Steve is a good guy. You can tell he is very helpful. He's very kind. He wants you to be protected no matter where you are. So if you want peace of mind, healthcare peace of mind, you need to call Steve Baker. He has the Medicare sources. He knows this. He's been doing this many years. He understands all the ins and outs of this healthcare system. 832-754-3292. Thank you, Steve. We appreciate that so much. I mean, it's kind of scary because the people that want to travel, they're at risk. Oh my goodness. But they have to call you first.
Mm-hmm.
Okay.
Yeah. Well, next week we're going to talk about if you watch the TV at all, we're talking Medicare. The term is just thrown around. One candidate that I'm thinking of is throwing around the term Medicare for all. Medicare. What does that mean? Medicare for all. In other words, when someone is born, they, according to this theory, they would be on Medicare, and if they live to be 104, they'd be on Medicare. So everybody's going to be covered by Medicare. Well, there's a lot of things to talk about there in terms of, and I'm not going to get into all that, But it's it's a political tug of war is what it is.
So we have a candidate that's running
Right.
for president
Uh-huh.
that says, hey, we need everybody covered from the second they're born to the
Right.
second that they die. We want them covered
Right.
medically through
Right.
the government.
Right. Through the government.
Now,
And
did they go as far as to say that they would allow private companies to come in and do the gaps like we talked about before?
you
Or
leave
they want medical to be completely covered by the government?
completely covered by the government
Now,
for the most part.
just answer this question. Is this a Democrat or a Republican?
I'm not going to say.
Oh, Steve.
I'm not going to say.
Steve, you're so good.
Right. But at any rate, it's a tug of war. And it's in the debates, we're talking about 2020 now as we talk, and those elections are going to be coming up, and there are going to be debates. So all that's going to come up in the discussion, and pretty much you can just ignore all of that because no matter which side you're on, they're just going to throw around the term and use it as a tool against their opponent. So it is what it is, and we'll watch and see what happens and let everything settle down, and then we'll just move along like we always have.
It is interesting as a human being, especially a United States citizen, there's a lot to deal with. Okay. We've got our families, and we've got our home, and we've got our work, and we've got our automobiles, and we've got leisure time, and we've got all these responsibilities. There's a lot to take care of. And health is just one of those major things that we try to say, well, I'm feeling good now. Everything is fine. And it's not until something like the can that cut that lady that's like, oh my God, now what do I do?
Right.
We try to ignore it because we're feeling good and nothing's going on.
Uh-huh.
But I do know that we need to think about it. We need to talk to someone like you who can help us through figuring out what if. No one wants the what if, but what if?
Right. What if? Exactly. Mm-hmm. And I think we have to ask ourselves this: what if? And because right now, as we speak, we're in a situation where there's a lot of stuff going on with what we're calling COVID-19, and it's just really a tough situation, and a lot of people are going to be thrown out of work and so forth, and all of that stuff has to be answered and taken care of. So it's going to be interesting to see in the year 2020 what happens.
Tell me, if you are 65 and you have Medicare, the traditional Medicare with no supplements or anything, you just have Medicare, and you got COVID, the virus, if you got the virus and they had to put you in the hospital and put you on the ventilator and whatnot, would they be covered through the Medicare system?
If they were just had traditional Medicare,
yes,
on the traditional Medicare side, they would be covered 80%.
80%. Okay, so they would have to come up with the other 20%.
Yeah, or have purchased a Medigap policy. On the other side, they could have something that's called Medicare Advantage, and Medicare Advantage is another totally different animal. And they advertise it as zero premium. In other words, you don't pay a regular premium for that. And there's a lot of rules and regulations over on that side. Typically, someone can either be covered with the traditional Medicare with a supplement or a Medigap policy. It's another term for it. They're exactly the same. Or they have a Medicare Advantage. And over there on that side, there's two or three different kinds of a Medicare Advantage to confuse things more. There's a HMO and PPO and so forth. HMOs are not quite as attractive as a PPO, but a PPO could be available for people in certain situations. And most of those have a very, very low monthly premium or zero monthly premium.
So If you're watching this on YouTube or Facebook, or you're listening to our podcast, I want you to know that Steve is available for you to talk to. He's very kind. He's very patient. If you just let him know what it is that you're looking for. Oh my goodness. My Siri just decided she was going to start talking to me. I want you to know that Steve is available, and his phone number is 832-754-3292. And we're here every week on Tuesday mornings at 8 o'clock Central live. But you can come and watch all the replays that we have. Please share this with your friends, your neighbors, your business associates, because this is information that we all need to know. Thank you for joining us today. Thank you, Steve, for all your information, and we'll be back again next week. Bye for now.
Bye.